after transfusion, the patient blood transfusion note should be written here. In blood transfusion notes, the patient name should be written here, their age, their gender, the date of the transfusion, and the time of transfusion should be written here. And the donor blood group, donor BG, donor blood group, which is here, in the patient blood group, which should be written here. Blood group and cross matching, which should be written here, which is being done. Now, in case of any reaction like fever, increase in respiratory rate, urticaria, sweating, and chill, the blood should be stopped, which is called a blood reaction. If these symptoms arise in the patient, this condition is called a blood transfusion reaction. So the blood should be stopped, and inject 2 cc dexa plus avel IV state immediately. It should be injected to the patient immediately or call to the doctor on duty. So this was all about on blood transfusion. So thanks for watching the video, and don't forget to subscribe, like, and share.